A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a shocking revelation, the UK COVID-19 Public Inquiry has published a damning report that highlights how more than 20,000 lives could have been saved during the spring and summer of 2020 if government restrictions had been implemented just 1 week earlier. The inquiry, led by Baroness Heather Hallett, criticizes the government's response as too little, too late, emphasizing a failure to grasp the severity of the pandemic's threat in its early stages. The findings, released in 2 comprehensive volumes, detail the chaotic decision-making processes that plagued the UK government from the onset of the virus in early 2020 until early 2022. The report paints a stark picture of the leadership under Prime Minister Boris Johnson and his chief advisor Dominic Cummings, who are accused of fostering a toxic and chaotic culture within Downing Street that severely undermined the country's pandemic response. Baroness Hallett noted that the government's reliance on misleading assurances about pandemic preparedness contributed to this failure. The inquiry's findings suggest that a more proactive approach could have avoided a total lockdown, which was eventually deemed necessary. The report not only scrutinizes the decisions made at the top, but also highlights the risks faced by vulnerable populations, such as blind and partially sighted individuals, who were not adequately considered in the government's planning. The Royal National Institute of Blind People, RNIB, has expressed concern over the lack of attention to the needs of disabled individuals during the pandemic, emphasizing the need for accessible communication and data to inform future policies. In the wake of the report, former Scottish First Minister Nicola Sturgeon acknowledged the challenges of leading Scotland through the pandemic, admitting that, with hindsight, earlier restrictions could have minimized harm. Sturgeon, who faced her own share of criticism during her tenure, expressed gratitude to the Scottish public for their sacrifices. Meanwhile, the Green Party has called for immediate action to improve pandemic preparedness, stressing that the government's delayed response not only cost lives, but also continues to impact families and communities across the UK. The inquiry has also been met with calls for accountability from long COVID groups, who argue that the government failed to recognize the long-term consequences of the virus. Nigel Rothband, chair of Long COVID Support, stated that while recognition of the issue is a positive step, it must be followed by meaningful change and accountability. This report serves as a crucial reminder of the human cost of governmental mismanagement during an unprecedented global health crisis. As the UK continues to grapple with the aftermath of the pandemic, the lessons learned from this inquiry must inform future policies and ensure that such mistakes are never repeated. The inquiry's findings are a call to action for all levels of government to prioritize public health and preparedness in the face of future crises. The emotional toll of the pandemic remains palpable, and as the nation reflects on these findings, the focus must shift toward ensuring that every voice, especially those of the most vulnerable, is heard in the decision-making process moving forward. Families who lost loved ones due to the delays in government action deserve justice and acknowledgement of their suffering. This report is not just a historical document. It is a powerful reminder of the responsibility that leaders have to protect their citizens and the dire consequences that can arise from complacency and misjudgment. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.